Welcome to Showcase Richmond. I'm Chip Tarkington. It's a condition that affects many, especially as we get older, and can impact so many areas of our lives and cause us to change the activities we do because of it. And yet we often are too embarrassed to seek help. Urinary incontinence, but there are ways to cope with it and even treat it. And that's our focus today as we talk with Dr. David Glazier of Virginia Urology for Women. And by the way, this gentleman was recently voted one of Richmond's 2010 top doctors for urology, urogynecology, and urological surgery. That's a lot to talk about. Congratulations, and thank you so much for being here. Urinary incontinence is not easy for people to admit they have, and so many deal with it on their own instead of seeking help. How many people does it affect?
We know it affects at least 13 million people in America and possibly up to 35 million people. It's a huge problem. What we do know, studies have shown that out of 11 women who come into a doctor's office with incontinence, unfortunately, only one will volunteer that information and the 10 continue to suffer. And there is so much now that we can do to help people with this very devastating condition of urinary incontinence.
We want you to kind of briefly go through the different types of urinary incontinence. Can you talk about them?
Certainly. There is mainly two types of urinary incontinence. The first one is stress incontinence, of where coughing and sneezing, laughing, or jumping on the trampoline can cause a leakage of urine. The other one is what we're called urge incontinence or overactive bladder. It's that sensation of gotta go to the bathroom, and they're the two major types of incontinence.
We're going to put a graphic up. I want you to kind of go over some of the symptoms of both kinds because I think it's important we put it up.
Yes, well, stress incontinence is where you have the bladder and the tube coming out of the bladder. There's a weakness in a valve there. So you lose urine by coughing or sneezing or increasing your pressure on your abdomen. And that's the primary problem, that's stress incontinence. And then you have overactivity of the bladder or urge incontinence, where you go to the bathroom 10, 15, 20, 30 times a day. You sometimes are not able to control it and leak urine, and it's very much a socially debilitating disease.
What are some of the possible causes?
Some of the causes it can occur with aging. We know that obesity is a major factor now, and we also know women who've had delivered children also are risk factors.
People don't have to suffer with this problem, obviously, and there are many treatment options.
Yes. If we look at, there's the two major types. If we address those, is the overactivity of the bladder, and the stress incontinence. If we look at stress incontinence, what are options for that? Or that you can do Kegel exercises. Unfortunately, we know that 50 to 80% of people who do Kegels don't do them correctly, so we recommend that you see a physical therapist, and we have two at Virginia Urology specifically do that. There's other things we can put in the tube coming out of the bladder called collagen. It's a bulking agent, it makes it harder for the urine to come out. Unfortunately, the results are not very good with that. The third thing is a sling, which is an outpatient procedure. Success rates are greater than 90%, and it's done. It takes less than 20 minutes to do, and it's a wonderful quick fix, to say. Then you have also the overactivity of the bladder is urge incontinence, is where treatments is behavioral therapy, looking at a diary, finding how much coffee people are drinking, trying to remove the irritants to the bladder, make sure they're not drinking too much. We can then give you medication to try and help that. Detrol or other agents and Nabalex are out there to help you. We also recommend you do physical therapy, help do special strengthening exercises, which you can do. There's newer therapies putting implants in your back called Interstim, and we do offer Botox for the treatment of overactivity of the bladder at Virginia Urology for Women.
Well, I think the obvious thing is you shouldn't be embarrassed, and there's so many things that you can do to deal with it. And boy, that's great information right now. And I can't tell you how much I appreciate you coming on. Your whole practice does such a great job. And if you want to find out more about Virginia Urology and the consultation and the help that they provide, I want to invite you to make a phone call to them or go to their website. The telephone number is 288-0339. And Dr. David Glazier, what a treat for us to have you in here today. Thank you for what you're doing for so many people, and thanks so much for being a part of Showcase Richmond.
My pleasure. Thanks so much.